So this is chapter 32, Promoting Reproductive Health, Sexually Transmitted Diseases. And this is an important chapter for you to pay attention to. There were several questions about STDs on the practice exam, and it is important just for your general knowledge as well, just to be familiar with these different STDs and how they're treated and what signs and symptoms we're looking for. So just keep that in mind as we go forward. Chlamydia trachomatis, obviously called chlamydia for short. This is the most common bacterial STD, and it is the leading cause of preventable infertility and ectopic pregnancy in patients. It's transmitted through unprotected vaginal, anal, or oral contact, and also during childbirth as well. It tends to occur more frequently in women, with the highest rate seen among adolescent females. Signs and symptoms depend on the area that's infected, but the signs can include abnormal vaginal bleeding, frequent urination, dysuria, pain during intercourse, and rectal pain or bleeding. Annual screening is recommended for all sexually active women who are younger than 25 years old. And treatment includes zithromycin or doxycycline. Those are antibiotics. And then you also want to make sure that if she tests positive and is being treated, that her sexual partners are being treated as well. Gonorrhea. So this is caused by a bacteria as well, and it usually occurs in conjunction with chlamydia. So chlamydia and gonorrhea are usually diagnosed together. So that makes gonorrhea the second most commonly reported STD in the United States. It's transmitted through contact with the penis, the vagina, the mouth, or the anus, and it is also transmitted through childbirth. Most females are asymptomatic, but if they do have symptoms, it can include dysuria, vaginal discharge, vaginal bleeding, irregular menses, postcoital bleeding, low backache, and urinary frequency. And treatment for gonorrhea consists of ceftriaxone. So that's going to be an antibiotic to treat that as well. Ceftriaxone. Pelvic inflammatory disease, or PID. This is inflammation of the upper genital tract in women, and it's most often due to untreated gonorrhea that leads to scarring, adhesions, or blockage of the fallopian tube. So this is why it's so important to encourage annual screening of STDs and then treatment as well. This can result in infertility and tubal pregnancy also, so you want to make sure that they're getting treated to make sure that they're not going to have issues with infertility or have an ectopic pregnancy. Symptoms for PID include severe abdominal, uterine, or ovarian pain, abnormal bleeding or discharge, low back pain, and nausea and vomiting. And PID is going to be treated with broad spectrum antibiotics. Syphilis. So this is one of the oldest STDs and is caused by bacteria. Transmission occurs through microscopic abrasions that happen during unprotected intercourse. The concern for women developing syphilis is that it can cause fetal anomalies if it's left untreated. So that's why it's important for screening prenatally so that there are not any fetal anomalies associated with syphilis. Stages include primary, secondary, latent, and tertiary. So there's 4 different stages that the person goes through, and their symptoms relate to whatever stage they're in. But the classic sign is painless sores. So you see stage 1, they'll have painless sores in their genital area, depending on wherever the location is. And then when they move to stage 2, a lot of times they'll have sores on their skin. There's a rash that forms after those sores begin to heal. So that's kind of a classic sign as it starts out as those sores. Then they develop a rash. So screening test for syphilis is called an RPR, or a rapid plasma reagent. And you'll see, and when we go to mother baby, you'll see that, or labor and delivery for that matter, you'll see that in their chart. You'll see RPR negative or RPR positive. So you're looking to make sure that they've had that screening for syphilis. If they do have syphilis, they're going to be treated with penicillin G. That's a classic treatment, is penicillin G. Parasitic STDs. So there's several here we're going to talk about. Trichomoniasis. So trichomoniasis is the most common curable STD in the U.S. Symptoms include a frothy gray or a yellow-green vaginal discharge. It does have a foul odor. And there's something called a strawberry cervix. So basically this is seen on exam when they have an actual vaginal exam done, and their cervix appears to look like a strawberry because it has these little small ulcerations on it. So that's why that's a classic sign of trichomoniasis, is a strawberry cervix. You can see a picture of that on page 1002, figure 32-2. Treatment for trichomoniasis consists of metronidazole or tinidazole, either one. The second one we're going to talk about is pediculosis pubis. This is pubic lice, and they have a crab-like appearance. So they're little bugs that have a crab-like appearance. So think about the lice we talked about on the head. This is pubic lice, okay? Now, they can also be on the fine, coarse hair of your eyebrows, your armpits, your eyelashes, or even beards because of the coarseness of the hair in those areas. Symptoms include bite marks that appear as bruises, little tiny marks that appear as bruises on the skin. And pubic lice does not go away without treatment, so it is imperative that they are treated. And the treatment includes permethrin 1% cream rinse. So they have this cream that is applied and then rinsed off to be able to kill these lice. Scabies. Now remember we talked about scabies previously. These are the little mites that burrow under the skin. It's very highly transmissible. I cannot talk today. Transmissible from person to person. Treatment of scabies consists of permethrin 5% cream. So pubic lice is 1% permethrin. Scabies is 5% permethrin. Human papillomavirus, or HPV. HPV is one of the most common viral STDs, and it can lead to cervical cancer as well as other types of cancer. So symptoms of HPV include a cauliflower-shaped wart on the genital and or anal area. It is transmitted by sexual contact, but a person can be asymptomatic and still pass the virus. It may resolve spontaneously without treatment, but it can recur, so it can keep coming back. And you can look at the treatment options on page 1005, table 32-1, as far as different ways to treat HPV. Now we know that there is a vaccine, an HPV vaccine that is available. It's recommended for girls between ages 9 and 26 years old, and it's recommended for boys between 11 and 21 years old. And we've talked a lot about the vaccine. We're not going to go through that again. One of the names of the vaccine is Gardasil. That's a pretty common name, but it is recommended for girls 9 to 26 and boys 11 to 21. Herpes simplex virus 1 and 2. I know there's a 1 and a 2. Both are transmitted by close contact with an infected person, usually when the lesions are present, but it can occur when they are absent because of the viral shedding that happens. So we're going to focus more on HSV2 here because that's primarily an STD. It is associated with genital lesions. You can look on page 1006, figure 32-7 to see that. The goal of treatment for HSV is to reduce symptoms. Usually antivirals can be administered to reduce those symptoms and minimize those outbreaks. We talked about HIV and AIDS, and we talked about that in the pediatric chapter. So you can review that on your own from that chapter, but also when we talk about women's health, you can review that on your own from page 1007 to 1010. So just review that on your own. We've also talked about hepatitis B. You can review that on your own from page 1010 to 1011. And moving to hepatitis C. You can review that on your own from 1011 to 1012. Hepatitis D is included in this chapter as well, and you can review that on page 1013. So a cancroid is actually a small bump on the labia that develops into a painful ulcer. So it starts out as just a bump, and then it begins to develop into a painful ulcer. You're going to treat this with an antibiotic. And you can read more about that if you would like to, but that's called a cancroid. That's something that can occur as well. So what is the nurse's role in fostering reproductive health through STD education? So obviously we want to provide basic information. We want to provide sexual decision-making skills and education about their body. We want to encourage active participation on their own health care, strategies for safe choices in intimate relationships, and protection that is available for them. Condoms, obviously, because those are barriers and they do protect from STDs, whereas other contraceptives we talked about are not those barrier contraceptives that protect against STDs. So they need a lot of education, especially in our adolescent population and our young adult population, providing that education for them. You can also look on page 1013 that shows you in box 32-5 other ways that we can help. That is the end of chapter 32.